Gislotuzumab for prevention of recurrent Clostridium difficile infection.
Clostridium difficile, one of the bacteria that can cause severe antibiotic-associated diarrhea. It can be debilitating. It's usually treated with antibiotics, and the antibiotics usually cure anywhere from 50 to 75%. But it's recurrent in the others. It keeps recurring. And it's very difficult to treat.
Without the protection of our normal bacterial flora, an overwhelming growth of C. diff can cause serious complications.
Between 15 and 30,000 people a year die of Clostridium difficile in the United States of America. More people are dying of C. diff in the United States now than are dying of HIV. The question is there data to say that probiotics can prevent this? Well, there's growing data. There's now 2 major papers. One of them is in the British Medical Journal, and a bunch of little papers that say we can at least decrease antibiotic-associated diarrhea. And the newer ones are showing we can actually decrease C. diff now by just giving pennies a...
Background. MCC infections, diarrhea, and in the inpatient population, Clostridium difficile infection source of a significant amount of M and M within other patients. Incidence doubled in the last decade. Up to 35% of patients treated for CDI develop a recurrence with 50 to 60% chance of repeat recurrences.
Of the 100 trillion individual bacteria that occupy a healthy human body, over 400 different species inhabit our digestive tracts. Most perform essential tasks like digesting food, synthesizing certain vitamins, and forming barriers against disease-causing bacteria. One disease-causing type of bacteria, Clostridium difficile, or C. diff for short, is a growing concern in the healthcare community in the U.S. and around the world. Inactive C. diff can be found inside healthy people without causing infection. However, your risk of developing a C. diff infection, also known as CDI, increases with age, illness, antibiotic treatment, and time spent in hospitals, nursing homes, or other healthcare settings, where multiple cases can lead to outbreaks. In healthcare settings, C. diff spores are extremely difficult to eliminate.
The role of monoclonal AV therapy. C. diff is responsible for the production of toxins A and B. Ectotuximab and bezlotusumab are human monoclonal AV that neutralize these toxins. Animal studies host species-dependent rodents A and B, piglets B, basic immunity with concomitant antibiotic therapy.
Clostridium difficile is a bacterium that causes infections of the colon, typically in elderly hospitalized patients. The bacterium secretes large protein toxins that cause disease symptoms such as diarrhea, colitis, and toxic megacolon. The toxin binds to colon cells via its receptor binding domain and is internalized by vesicles called endosomes. Acidification of the endosome leads to translocation of the protease domain and the enzymatic warhead into the cytosol. Inositol hexakisphosphate, or IP6, present in the cytosol, binds to the toxin and activates autocleavage, thus releasing the the toxin into the cytosol. The activity of
study design: 2,655 adults randomized, 85% completed trial. Median age was 66 years old, and 68% were inpatient. So here we have that the study was made in 322 sites. It's about 30 countries. The inclusion criteria of this study: adults with primary or recurrent CDI, stool test positive for Class B, receiving oral standard of care antibiotic therapy for Clostridium B treatment, 10 to 14 days, metronidazole 47%, bacamizine 48%, and fidamoxin 4%. Treatment administered on or day after infusion. Diarrhea is defined, or the definition of diarrhea in this study was 3 or more unformed bowel movements within 24 hours, type 5-7 on Bristol Stool Scale.
Diarrhea is the condition wherein frequent passage of loose, watery stool occurs. Diarrhea can be defined as absolute or relative diarrhea. Absolute diarrhea is the occurrence of more than 5 bowel movements a day. Relative diarrhea is the unusual increase in the number of bowel movements in comparison to an individual's usual bowel habits. The types of diarrhea according to severity are acute diarrhea, chronic diarrhea. Acute diarrhea is a type of diarrhea that usually lasts a day or two and heals on its own. Acute diarrhea is most commonly caused by infection, which can be viral, bacterial, or parasitic. Certain medications can also cause diarrhea. Diarrhea that lasts for at least 4 weeks is termed as chronic diarrhea. Chronic diarrhea is commonly caused by a functional disorder such as irritable bowel syndrome, infectious diseases, an inflammatory bowel disease such as Crohn's disease, colon cancer, a recent abdominal surgery, severe constipation, carbohydrate or fat malabsorption, endocrine system malfunction, or abuse of laxatives. Diarrhea usually starts with crampy abdominal pain